Thorough pain history and shared goal setting are critical components of effective pain management that leads to beneficial outcomes. Inadequate postoperative pain management and assessment continues to be an issue in the medical and clinical setting. There has been an appalling high rate of postoperative pain. This is evident because according to NURS2006, there are approximately 80% of patients that are experiencing postoperative pain, and with fewer than 50% receiving adequate pain relief. Persistent postoperative pain is caused due to the continuous undertreatment of postoperative pain and is evident as 2 to 10% adults are experiencing PPP. Approximately 235 million patients worldwide are suffering from the consequence of PPP every year. Patients who are at greater risk of being undertreated include pregnant women, pediatrics, elderly, opioid tolerant, and those undergoing ambulatory surgery. In the healthcare setting, healthcare professionals should prioritize patients' post-operative pain management and assessment in able to reduce the consequences and the risk of PPP. Using appropriate assessment tools and good management of patients' post-operative pain can improve their comfort and facilitate a recovery process. It will also enhance early mobility for patients and lessen the risk of serious complications such as ileus, urinary retention, myocardial infarction. Failure to control patients' postoperative pain will lead to delayed discharge and recovery time that may result in patients' inability to partake in any rehabilitation programs, leading to poorer health outcomes. Current practices in regards to postoperative pain management and assessment includes using pain assessment tools, such as the visual analog scale and numerical rating scale. Although there has not been an introduction to new analgesic drugs, there has been advancement in technology to administer the older drugs, which include transdermal and pain-controlled analgesia. It is evident that PCA had provided a better outcome to patients. That includes better pain control, and there has been an increase in patient satisfaction. Postoperative pain assessment and management issues still facing many challenges, even the healthcare professional has given them pain interventions or pharmaceutical interventions. This graph depicts that post-operatively, 24 to 48 hours, patients are still experiencing mild to severe pain. Most of these patients have received analgesia to maintain and decrease the pain that they are experiencing. Pain assessment tools, especially the numerical rating scale, has been used in those surveys and indicates that even with pain assessment and management, there is still pain present in patients. This graph shows that there are no major changes to patient pain while at rest and with movement. This indicates there is a gap in the healthcare system that healthcare professionals are missing to manage patients' pain. Good use of pain assessment tools results in failure to maintain and manage patients' pain and discomfort. Pain assessment does not only include the tools provided, but also what the patient is experiencing. It is known that nurses may take shortcuts to their practices as they have a busy day ahead of them, and this is why patient-centered care are not met. Many nurses worldwide may be lazy and does not fully examine and assess the patient's pain using appropriate tools. Healthcare professionals only rely on the objective but mostly forget about the subjective data. Studies have shown that there were inconsistency and infrequent on nurses' assessment on pain. To improve the inadequate use of pain assessment tools, the recommended practice is the use of the pain assessment tools such as visual analog scale. This is a tool where patients rate their intensity of pain from 0 meaning no pain and 10 to worst pain imaginable. Studies have shown that these tools have been validated for accuracy in detecting the intensity and severity of pain in patients. There has also been inadequate evidence on the effects of different use of pain assessment tools. Therefore, nurses should base appropriate pain assessment tools on factors such as developmental status, cognitive status, level of consciousness, educational level, and cultural and language differences. Evidence has shown that the standard of effective pain management to patients are not met due to poor documentation of healthcare professionals. This is evident as there were insufficient pain observations recorded and documented made by the nurses. With this, there is only data recorded on the use of analgesics but non-pharmaceutical interventions, or how the patients were assessed under pain. This is still an occurring issue within the healthcare system, as nurses may just assess patients based on subjective data, but also need to make sure that proper assessment tools are used. This will encourage patients' speedy recovery, as the interventions will be more appropriate for the pain that they are experiencing. Healthcare professionals should be more aware of the importance of good documentation of patients' pain assessment and management. In In order to improve and meet the standard of good postoperative pain documentation, healthcare professionals can seek out education and monitoring systems. Healthcare professionals can attend educational programs to develop mentoring on systematic evaluation of pain documentation. This will broaden healthcare professionals' understanding on how to properly conduct proper pain assessment documentation. The implementation of these educational programs will not only assist nurses but also patients, as with proper documentation, healthcare professionals will be able to provide and implement the correct pain intervention and management. Positive emotional outcome can be achieved by giving proper postoperative pain education to patients, such as preoperative education, education about the expectations of the pain they will be experiencing, and knowledge about the pharmaceutical and non-pharmaceutical intervention available for them. Studies have shown that there is a lack of sufficient education in pain for patients. With patients insufficient knowledge on pain education, it is allowing them to feel stress and be anxious at the effects their cognitive behavior and psychological behavior, which will further increase their pain experience. This gap in the healthcare system is resulting patients to have limited knowledge on the importance of postoperative pain reporting and management. Evidence-based practice shows that if healthcare professionals provide pre-op pain education, it will provide patients the expectation of post-op pain. It is vital for nurses to provide the proper pain education both pre-op and post-op, as it will give them reassurance on the expectations of post-op pain. This is evident as healthcare professionals should provide patient and family-centered and individually tailored education. This education includes goals in achieving post-op pain management, treatment options, and aim to correct any underlying misperceptions about pain. To conclude, postoperative pain assessment and management is still a current issue in today's society, as there are still a number of patients that are experiencing moderate to severe pain postoperative. Healthcare professionals must be aware of not only managing and improving the patient's pain, but also using proper interventions and management. Postoperative pain can not only be managed by analgesics, but also healthcare professionals must be reminded that skillful pain assessment, using appropriate tools, good documentation and evaluation of pain, and patient education are required for the effective pain management that leads to beneficial outcomes.